After James P. Lee, the 62-year-old vice chairman of J.P. Morgan Chase, died suddenly after a treadmill workout last week, it is raising concerns about exercising during the middle and later years. WSJ health reporter Ron Winslow and Dr. Sumeet Chugh, director at the Heart Rhythm Center, join us now to discuss. Ron, I'm going to start with you. First off, what exactly do we know about James Lee's death at this point?
Actually, not very much, Tanya. The bank put out a statement saying that he had shortness of breath during exercise, went to the hospital and died there. So exactly what the cause was, we don't know. There are sudden cardiac arrest is certainly a possibility. There are a couple of other possibilities as well. So, but nevertheless, it does cause one to wonder.
Sure, and he was known for exercising regularly, correct?
That's what we understand, yes.
We understand, okay.
He squeezed them in during a busy daily schedule, so.
And doctor, how common are exercise-related deaths for people in their middle years? And does exercising regularly still have benefits that outweigh those risks?
I think that in the big picture, these sudden deaths during exercise and middle age are not very common. In fact, from some work we've done and published recently, these make up only about 5% of all sudden deaths that happen in middle age. And again, your second point resonates because if you are a habituated athlete, then your risk of having sudden death with exercise is even lower.
So, Ron, as people are living longer and in many cases better, they seem more determined than ever to keep exercising. Is that what you found in your reporting?
Yes, I think that's, I mean, we all sort of take pride as we get older in keeping active, want to participate in sports, and, you know, but also have to be aware to some extent that our risk could be increasing. So it's really important to be watchful of cardiac risk factors like blood pressure and cholesterol. Certainly don't want to be smoking. If you have any other ailments like diabetes, you'd want to bring those under control. So it's sort of part of your overall heart health to manage your risk factors. But exercise, I mean, there's study after study, as Dr. Chugh knows, that vouch for the benefits of that, of exercise, much more than any risk that you'd find.
Absolutely. And doctor, how can we be very safe about it, though? What should we know about rigorous exercise as we age, the kind of exercise that raises our heartbeats very quickly?
Well, the first thing is that the level of exercise it takes to really exert yourself and have a sudden death, most of us cannot even attain. And I'm talking about the ultra marathoners or the 100-mile runners, etc. I think for most people, the best thing to do is to start gradually. So when I give an exercise prescription at the Cedars-Sinai Medical Center in Los Angeles, and if you're talking to a couch potato, you always make sure that they spend 6 to 8 weeks to reach a good level of exercise, and that is very gradual. Yes, go ahead.
No, I was just going to say, are the symptoms sometimes of heart disease always present? Is there a danger that we may have heart disease and not even be aware?
Yes, unfortunately, there are some people who are going to have their sudden cardiac death or sudden cardiac arrest as the first sign of heart disease. So we can all be surprised. And while the screening methods are not perfect, what Ron says applies universally. If you take care of some of the risk factors, you just can't deal with the cards that you're dealt with, which is your genetics.
So Ron, after reporting this story, what is your takeaway advice?
You know, I think we all want to keep exercising, you know, do so in moderation. One of the other people I talked to for the story says, you know, men in particular are always pretty competitive on the treadmill and they want to do the extra 10 minutes. And you may not get very much benefit from the extra 10 minutes. Moderation gives you a whole lot of benefit in this. But I think it's important not to take news events like this out of the broader context, and that getting regular exercise is not only important but very safe.
Yes, we all really enjoy exercising as well. That's the other part of it. It lifts our mood and helps us feel better as well.
For sure.
Ron, thank you so much. Dr. Chugh, thank you so much for that.